Thinking. So once this gets going, I'm gonna do a round of introductions, and then Barbara, if you want you to tell us your community feedback, and then we'll start to go down the agenda.
Okay, so I can speak now?
No, I'm just
No.
trying to tell you. Yeah, sorry.
All right, just tell me when.
Yeah,
I'm just having we're having excavation outside, so it's pretty intense.
Okay. All right. So let's do a round of introductions. I'll have the people on the screen go first. I'm Emily Flynn. I guess I said I was going to have people on the screen go first. Troy Ellen, do you mind introducing yourself? And then Barbara, Kristen, and Bob.
Hi, I'm Troy Ellen Dixon. My pronouns are she, her, aya. I am chair of the Live Well Kingston Commission. And I'll hand it off to Kristen.
Hi, I am Kristen Kessler. My pronouns are she, her. This back of his head's Walter Finn-Schleifer Kessler. I'll introduce him for his first meeting. I use he, him pronouns, but he has not identified his pronouns yet. So one day in life, he may share those with us. And I'm a project manager in the Department of Health and Wellness, working on the Creating Healthy Schools and Communities grant. We're currently on maternity leave. So I'm here. I will pass it on to Barbara.
Hi, Barbara here. Alderwoman, Ward 1, Kingston. I guess I'm the liaison to this group. And yeah, I'm also the chair of the Ulster County Community Services Board, which is the mental health, substance use, and PWDD folks. Oh, I guess Bob.
Hi, I'm Bob Dennison. I'm the chair of the Complete Streets Advisory Council. And I don't know, what else shall I add? That's it.
Sorry, everybody. I was just closing the doors so that there's another meeting happening in conference room 1. So this is the sound. Do you guys see?
No, they just
finished. All right. So I'm Emily Flynn. I'm the director of health and wellness for the city of Kingston. I'm she, her pronouns. It's great to see you all. Tom?
I would love to. Tom Polk, YMCA. I am the program manager for the bicycle programs at the YMCA.
My name is Ellie Gartenstein. I'm the city's environmental specialist. I'm here as a guest representing the sustainability office. We're going to talk about bike share.
Hi, everyone. I'm Marcia Sebro, project manager of the City of Kingston Health and Wellness Department.
All right. All right. Thank you, everyone. All right, Barbara, now that we're recording, do you want to tell us your communication from the community?
Yeah. I believe the same day that they made the bus fares free, they changed the schedule without notifying riders. So I think that was more than 2 weeks ago. There's still no paper schedules and no schedules posted on the bus shelters, as far as I know. Also kind of confusing what was posted on their website. I've had to transport my brother more than usual. He's a person with schizophrenia and a bit developmentally delayed, but it's a day trip, as you know, on transportation to get from, he lives at Chamber Senior Housing, say he has to go to Institute for Family Health. It's, pretty intense. And then to have the schedules now be up in the air. And luckily he calls into dispatch. He knows how to do that. So the county budget is up for renewal. There's a certain time frame for that, but I was asked to just note it here because one of the big changes was to the KS route, the Kingston route, and so I think you have a not sure, a transportation, Livewell, something. So, I didn't print out the dates, but, I'm gonna try to meet with the acting county exec and, call a few of the Kingston legislators like Peter Criswell, Abe Utitel, and Phil Erner. And well, Phil's aware. He's on this Riders of Ulster Transit Alliance. They meet every Sunday via Zoom. So yeah, and particularly Tanya was mentioning the senior housing over by Smith, Tremper, Elmendorf. They kind of reduced stops there because they made up, that there's a shopping bus one day a week, and it's not very user friendly. And there's no benches over there, but it impacts seniors, impacts people with mental health challenges or behavioral. My brother doesn't have a car, etc. And the cabs are unreliable, and and to have this schedule change, people couldn't get to work who were relying on a regular schedule. So my brother's very low key, so he wasn't being assertive enough in telling me what was going on. And he's so polite that he was more concerned about the drivers not knowing the new routes. He's thinking about the drivers. Also, they're understaffed, like everything, for drivers. So, yeah, it's the big thing, I think, what is the lack of communication to the community. So that's the key. And I believe the director of transportation for UCAT is fairly new. Nice guy, but should not have implemented these changes without some community input. So I think that's how I'll leave it, but it's yeah, it's disconcerting. I mean, I guess one reason why they changed some of the schedules was it was for the union. The drivers, they couldn't work 10 hours shifts, but, and they were, I don't know, there's a gap in the middle of the day when they take lunch. Like my brother, I could never figure out if he could get where he was going or get back. Could I give him a ride to the place, give him a ride back? So, I don't know how other families do this. And my wife was just a care manager at Mental Health Association, supervising 8 care managers, and they're just like, oh my God. So that's all. I just wanted to note, I don't know how I would engage you all in terms of, if there's a letter sent to the county legislators or to the county exec regarding this situation.
Yeah, so thank you, Barbara. Right, I think you mentioned, so the buses are under the county control. So the city, this commission could write a letter of concern or something to that effect, but we don't have any other jurisdiction other than that.
Yep.
Unfortunately, we don't have quorum here tonight, but I think the commission could send a letter if they wanted to, and I'd be happy to send that on their behalf. That might be something the commission could discuss tonight if they'd like. That's pretty much all I can offer you at this time, Barbara, unless you have another specific ask.
When could a letter come from the commission? Would it wait all the way until late November, like the 3rd week of November? Because the county budget will already be well along its way. So
no, I don't think we would have to wait. So the way that we've done letters of support before is that we get approved, we run it through the chair, and if the chair agrees, the chair is sort of able to speak on behalf of the commission in support.
Okay.
That's what we've done in the past.
Okay.
Jamila is the chair. Mostly, I think we could use some help with language. And then what I would like to do with that is send it to the whole commission for feedback. And then we could send it.
Okay. All right. Yeah, thanks, because it's so related to health, as you know, and trying to get the jobs and get their food and get, some, break some of the loneliness, especially for seniors. So, all right, thanks. I'll proceed with that.
Thanks. Bob, you got your hand up?
Yeah, I've heard the same complaint from users of the system that things have come broken down and that it's taking people hours to get to work. And so it's going around, and lots of people that use the system that I hear from are also complaining about the lack of knowledge and the lack of consistency and the lack of dependability. And, but basic transportation, if a public transit system is not dependable, it will not survive. So that's an important issue that they need to address. People are not going to put up with a system that doesn't meet their needs. But my 2 cents.
Thank you, Bob. All right. Susanna and Heidi have joined us. So I was going to give them a chance to introduce themselves and then sort of move to our agenda, if you don't all mind, unless there's any last urgent thoughts or questions about that. Yeah, Troy, come ahead.
I had my virtual hand raised, but I guess you can't see it. That's quite all right. I understand that there were issues with the bus schedule even before this happened because they did not have enough drivers so they're doubling up routes. If we can, Barbara, if you can provide as much information about the issues that have been ongoing, we should include those in the letter as well. I made the comment to somebody, it's all nice that it's free, but if somebody's standing on a corner for an hour and a half, it doesn't matter if it's free. So we just want to be as comprehensive as possible, but I totally support and would recommend to the other commission members that we send a letter. Thank you for bringing this up.
I'm just curious if bus drivers shortages or public bus companies for school bus drivers.
County transit.
Barbara, if you're speaking, you're on mute.
I'm sorry, Susanna's talking right now. Hold on one second.
Is there a big shortage?
I can't speak to that, but I don't know if you heard it when Barbara started, the schedule's changed. So we want to talk about that.
Yeah, I think they're looking at ridership too. And if it's low, they're combining routes thinking they'll fill the buses up better. But what they're going to do is lose people because they go through every nook and cranny of the city to get where they're going. And it's just a mix of things that don't make for, supporting the ridership and what we're, So, all right, those are good suggestions, everyone. I'll see what I can draft up and get to the chair and onward. Okay.
Thank you, Barbara. Yeah. All right, then, unless there's anyone else who will be down. Heidi, do you want to introduce yourself and then Susanna?
Sure. Good morning. Good afternoon. Heidi Kirshner with the YMCA. Been with the commission for a while. Thank you.
Susanna County, the Institute for Family Health and Commission. Coming up to the end of my second.
Not that you're counting.
No, I didn't talk about today, but
all right. So thanks, everyone. In our agenda, we had approval of minutes at the top, but we do not have a quorum, so we'll have to postpone that until next time. Which then brings me to administrative matters. I have another copy of the agenda. Before it, but so next up on the agenda was administrative matters, and so I wanted to bring up this discussion quickly about how we're not getting quorum It's been 4 months and we really need commissioners that will join us in person because that's how the law is written right now. In addition to that, Siobhan, our commissioner, has just stepped down. She gave her notice this week. So we now have 8 commissioners. And in January, that's sort of a time when what do you call it? The times that people have signed up for will sort of come to an end, and it's a time that some people may want to step off. So we would probably have open seats then as well. So just sort of might be a good time to try to bring in a group of new commissioners. I can tell you what I've done thus far to work on this. So I emailed Megan Weiss-Rowe, who works for the Novo Foundation and used to work for the city and has lots of connections. And I emailed Kristen Wilson, who works for RUPCO, who is sort of the founding mother of Playwell Kingston, asking them for recommendations. What else did I do? There's another one. So I'm starting to do some outreach. I'm going to make up a elevator speech or blurb about sort of what Kingston does, so that, and I'll put it in an email and send it to everyone so that you can easily forward it on to anyone that you might think of that might be a good fit. Any questions there about that? Continue.
Just to, I mentioned earlier, I guess I was wondering if there are skill sets or areas of interest / focus experience that we're looking to fill within the certain scope and breadth. Are there people who represent certain disciplines or areas?
Troy Ellen is saying that she's having trouble hearing us. I might not be able to solve that right now. So this is our first time using this room. There are mic systems that I didn't set up. I was hoping we weren't going to need them tonight. So future meetings, I can set up mics. I don't think I can bring the screen any closer, but I'll try to yell more. So Susanna's asking, what are we looking for in commissioners? In the past, we've sort of talked about targeting people who spoke Spanish and trying to bring that community into Liverpool Kingston. We did some specific outreach in that effect, so I think we would all be open to that. Since Liverpool Kingston to the social determinants of health, and health is so broad, it actually needs for a pretty broad base that we reach out to. I think we've had great success in people who work within the health spectrum professionally. They're sometimes able to add that to their work hours. Troyellen or anyone else have thoughts about what we were specifically looking for in a commissioner? We can continue to think about this and come back to it. We don't have to have a solution soon.
I have some thoughts not about what we're looking for in a commissioner, and I'm not sure if we've done this before or not, but in terms of trying to do some prospecting, reaching out to various organizations in the community, providing them with, please share this with your network information. And, and I'm thinking everything from For the Many, UIDN, ROC. If we do a call for commissioners, we could put it on KMA, Kingston Mutual Aid, because it certainly qualifies as one of the posts, so that we get it out into social media more.
RUC is Rise Up Kingston.
All right.
What?
Susanna was asking what RUC was. It's Rise Up.
Yeah.
All the acronyms are.
Yeah, lots of acronyms. Yeah, so I think it's great. I think I sort of know what the next steps are. So I'll write up sort of a description of Liverpool Kingston, and we can start to do some more targeted outreach. I think that's probably the next best step. And also just bringing it up here. So now it's all planted, the seeds are planted in your mind. So if you're going along your daily activities, you're like, oh, this person's interested in mental health, or this person's in active transportation, or gardening, many of the buckets that we use here at Playwell, it might spark your memory to bring them in. So that was my first step. Any other thoughts about that now? See any hands up. So then that'll bring me on our agenda to a presentation by Marcia about Playwell. Marcia, if you don't mind trying to project a little bit. So I can hear. And while you're talking, I'm gonna go see if I can get the mics. So I might be able to solve it while I'm talking.
I just am taking up my lunch to be mindful of the time.
Say, why did they hear you? You're close
I
to-
think because I'm here and I'm sort of yelling at the screen.
There's a way to turn on the fan overhead.
I do not know. Okay. But I'm gonna go see if I can get the mics.
Okay.
And if you don't mind, try to project.
I sit there.
Yeah.
Yeah. Okay, hi, everyone. I'm just going to do a brief update on the Playwell focus team. So I want to start just by giving an overview about the mission of Playwell, which is the aim of Playwell is to develop, implement, and support policy systems and environmental change that facilitate the growth and maintenance of public parks, recreational facilities, and open space and other recreation in order to increase safe and accessible use and physical activity for all users. This team facilitates the development of programs that encourage utilization of parks and open spaces and play. And we support initiatives that connect people to physical activity and other play resources. And you can find out more about the Playwell Focus Team and its mission on livewellkingston.org. So the current Playwell action plan, the most recent action plan was done in 2021. That was when it was last updated. But let me jump back. Prior to that, I want to share some of the achievements of from the July 2020 action plan. These included the installation of chess tables down at TR Gallo Park through a 2019 awarded grant from AARP. There was a Chalk the Walk event in September of 2020, which included 7 collaborative partners and residents, and it was events occurring throughout several Kingston locations on the same day. Our current action plan, which was last updated in 2021, the objectives were to build a coalition, reach out to Kingston City School District, to also for the team to coordinate and create programming for what was called the Day of Play. And it also looked at proposing a new park policy process. Any questions so far? That's about the action plan. Okay. So I will say that presently, for 2022, there have not been any Playwell meetings, and we have yet to set a date for the next Playwell focus team. My role in health and wellness, I've been with the department in the past 6 months, and in thinking about coalition building to resurrect this focus team, I want to just briefly share with you some of the things that came up in that work. In previous years, and prior to my being with the department, there were about 16 individuals like representing a number of community organizations and businesses here in Kingston, including Innate Movement Parkour, YMCA, Wild Earth, Fearless 261, Parks and Recs, department here in the city, Health Alliance, Center for Creative Education, and Kingston Library. There have been 5 Playwell meetings between June 2020 and April 2021. So in being tasked with resurrecting Playwell, one of the challenges that's come up for me is how to engage potential partners whose time is spent providing a lot of the recreational programming in the city that is already very successful. People are very busy. And so I asked myself, well, what's in it for them? Are we getting them in a room and asking what their priorities are, and then collectively deciding how those priorities fit into the Playwell mission? Or are we bringing to the table an already identified challenge or an unmet need that is in the purview of our mission, and then coalescing to bring forth policy and environmental change? So I haven't figured out the answers yet. And I'm hoping to get support from everyone on this call. If not today, but to just plant that seed in your. Yes.
So I don't know if you guys can hear me, did you get feedback from any of those original participants about why they dropped off?
No, I did not, because I don't understand it that they dropped off, but that there was not in health and wellness. I mean, maybe this is something that Emily can speak to, but a capacity to keep it going, plus COVID, right? So the last activity was done in 2020. So everyone was social distancing, and it took a pause. So it's bringing it back from a pause, but it's also an opportunity to kind of look at membership and like how do we approach coalition building this time.
Marcia, as a member of that committee, I like the approach of getting these groups back together and saying, sorry, I know you can't hear me. Getting the group back together and, presenting it the way you did was say, how can we achieve what your goals are, but also accomplish what the goals of the mission are? And I think you would be surprised to hear how many people probably will just riddle it right out, things that they're working on, but realizing, we all just worked on it together, we can all be successful. So,
I struggle with that. I've talked to Emily about this because I don't think you're the only focus team that struggles with this. Getting folks to come together and identify the purpose. And some are very clear that they come together to share their respective organizations' work in that focus area. So whether it's like Playwell or some other area, it's very clear to sort of networking, sharing what's already happening in each agency. Maybe there is some cross-pollination of ideas. And I think other ones, like I've been part of Playwell for a long time, and I think we really struggle with attendance, and we struggle with identifying what are we creating something new and different together, or are we identifying, as you say, like very clear gap or need that together the organizations are going to try to address it. But I think articulating that is really important. Coming to some teams have harder time doing it than others, but
And we also know that for those members who, for the individuals and for the groups who participate, it kind of organically, has a life of its own because there is that shared space. So the actionable items are created by the members who are participating. Because they're in the room.
Troy Ellen, you had your hand up. Did you want to say something?
Yeah, I'm not sure. Susanna might have been going down this path, but there's still some issues, at least for me, hearing everything. I know you've done your best, Emily.
I don't figure it out tonight, guys. I'm sorry about that. Next time I'll try to have it
I'll
better.
scream next time.
Thank you, but the point that I wanted to bring up is the fact that I think this is how Marcia said it. Are we asking the community, or are we bringing identified needs for, consensus and support, or a version of that? And what I'm thinking is there's a lot of this stuff already happening in the community. We just may not know about it. And it falls within the Playwell. So for example, the Y, CCE, they already have a lot of things going on. We just don't know exactly what they are. So instead of, Playwell trying to bring something to them, Playwell should continue to reach out to find out what is being done and how Playwell can, if necessary, support those sort of initiatives. I know there are things being done at the African Roots Center, for example. So that's what I wanted to say. And as I said, if I'm repeating something Susanna said, forgive me.
So as I shared last month, when I presented on Age Well, that I did I conducted several listening sessions with, seniors in Kingston. I attempted to get conversations going with some of the leaders here in the community. And as you all speak, I'll be taking notes on who else I can reach out to. So I just want to briefly share with you some of the feedback that I've gotten. The other thing to be, I used that word organic before, just kind of in understanding how busy everyone's time is. Summer is the peak of recreation season. It is not a good time to ask people for time. We have to winter well with it. I mean, I reckon Parks and Recs, which is in the building that we showed, the Ellie's here from, it's like bananas. It's like high time. Like you can't, everyone is so on the ground with summer programming. So it really was not a very good time to ask people for time, because I want, just in observing, you gotta read the room with these things. The time I was offered, which happened, it wasn't in a sit down meeting, it was kind of like doing things with people as they were moving and grooving. When I met with Dennis at the Boys and Girls Club, and I asked him, I said, what can health and wellness do to create or enhance, what the club is doing and what some of the members might need or be interested in? He said, find something that speaks to our minds and souls, something outside of their community. This is about club members, particularly the juniors, because the torch kiddos are pretty agreeable to do things. But for the older members, and he gave examples of activities like hiking, overnight retreats, fishing, rowing, and archery. When I spoke with Drew very recently over at CCE, I was like, what's on your mind? One of the things, because there's so many fun things going on. He said, securing more funding for adult programs, because there's fees for adult programs. A lot of the funding that they receive through scholarships are primarily for kiddos, for children. When I met with Frank at the farmer's market, we talked about lots of things, but one of the things that he shared is that he is working on a centralized portal for promoting my Kingston Kids in partnership with the city's Arts and Culture Department and Kingston Happenings. So his focus is there's stuff going on and there's all these community calendars, but they're not sort of like working, like in unison. So how can we get with that and with the city too? So, so that was about comms and systems change. I also want to share that I spoke with one of the project managers with the City Parks and Recs, Jack Shoemaker, about the DRI and the renovation for Deet Stadium, which I am anxious about because when it's renovated, where am I going to walk? So I'm a big Deet Stadium walker, and I'm not alone. I mean, the park is very high usage, and so I asked him, like we were talking about, potentially having some kind of educational campaign. Last week when I tabled at the Human Services Expo, I asked people walking through if they knew that Deet Stadium, I asked them, how they recreate, get those conversations going, and none of them knew that the stadium would be renovated. I asked them about a dozen people. They were like, what? And it's not because the information is not out there, and I directed them on where they can find out more, but they were like, but also everyone was excited that it was going to be renovated, but the park is so highly used, so.
How long is that gonna take?
It's going to,
It's gonna be phases.
yeah, in phases.
How many years?
I don't know exactly. It's not engaged Kingston. They started with the pool, so they put in a splash pad. They're working on the pool house now, which is great because it's closed and we need it so bad. So, like the locker rooms and showers. I mean, they're going to move the basketball court. They're going to do the everything's going to be moved. The entrance, we're going to get a new field, a new grandstand, a new sign, a new locker rooms. I don't think a new grandstand. I think they're improving. They're improving the grandstand. They are.
Yes, the grandstand,
Everyone in the speak.
because the grandstand, like they looked into, it was going to be astronomical.
And there was some historical value to the grandstand
Oh,
as
okay.
well, so I think that's why it's plans are beautiful. But you raise a good valid question, how is it still gonna be open for a lot of public use? I think the intent is yes, but I don't.
But this could be, like, for example, an opportunity. And I just want to say that you can find out more about that project on Engage Kingston.
I'm putting that in the chat.
Yeah, it's great.
But it doesn't, I couldn't find it fast enough to know when the construction will be done. But I think years, I think like a year.
And it may start as early as, I was after just November.
Yeah. So after football.
All right, let me see.
Sounds like you're doing a lot of work.
Yeah.
Doing a lot of-
If I can compliment Marcia, she's meeting with a lot of community members. And if I can brag on you a little bit, Marcia has wonderful skills in creating community and like creating connections with people, much better than myself. So I feel like when it is time for Playwell to meet, it's going to be a more genuine connection. So I think it's worth the wait.
So, Emily, yeah, but I've also been talking to people about this work and letting just people in my own network know about Playwell, and I have had some interest in like residents in Kingston who teach, who coach soccer, who do salsa, who dance, and also the cross pollination from another one of our buckets, one of our Age Well focus team members who lives here in the city of Kingston who's particularly interested in engaging active seniors. So she is retired and wants to see, wants to better understand what opportunities that there are for seniors who are more active. Because she bikes and hikes and swims and just does things like, she's very active. She's like, you don't just want to sit and knit.
So I've talked to Emily about this very recently. So I have often, and I've talked to her about this, seen a potential for a beautiful collaboration between parks and recreation and healthcare providers. And there's, obviously huge, they're obviously linked in terms of health outcomes and promoting exercise and being outdoors, benefits of being outdoors on well-being, mental well-being, physical well-being. And I think educating healthcare providers that see all kinds of residents, especially providers like the Institute that we tend to serve the most vulnerable populations, to educate them more on to educate their patients on the availability of parks and recreation opportunities. So I talked to them before about this thing, you will, and that I would love to do something and even have available like maps and things in our waiting rooms and things that providers and nurses can give out to patients, and to promote the use of natural resources. And I think there are other providers that are interested too, right?
And I, as a part of my presentation, have that under opportunities around seeking partnership with Health Alliance to promote recreational programs, right? Because we've got a lot of opportunities. I don't know if everyone knows families that are not already plugged in with the spaces that we know, all the ones that we just mentioned with Live, which is phenomenal, Boys and Girls and CCE. Are they aware of the free and low cost? Is that something that they're interested in? So I want to be mindful of time because I know that Ellie is presenting. In the notes, there is a link to the Playwell survey draft that I created. Because I wanted to start from a place of, well, let's see how people are using parks and what they think about physical activity. I did launch this at the Human Services Expo while I was tabling last week and got some feedback, everything from some grammar that was incorrect to thinking about my write-in question, and this is a survey that I want to launch both online, and maybe it could be left out in waiting rooms. I don't know. I'm gonna, but I want to say that the point of the survey is to identify park usage and opportunities for environmental improvements that might increase access and usage of our public parks, to assess environmental and behavioral changes, environmental and behavioral challenges, to engaging in recreation and physical activity, which brings us to the social determinants of health, and educational awareness about the things like the guidelines for Americans for physical activity, and potentially could we create or enhance communication systems that connect families and adults to low cost and free physical activities. Because sometimes we're in an echo chamber in these groups because we know each other and we know what's offered. We have someone new in our age role focus team who is not a part of this group. She's new, and she said, I can't believe, I actually heard this last week too. I shared it with OFA, who sponsored the event. I can't believe that there are all of these services and things happening here in Kingston. If you're not a part of this work, So I want to hear from people who are not plugged in, right? So the challenge is always how do we engage, like the community that way. So, but that's what the survey does. It lists all of the public parks, if people use them, how often, what activities they do there, and some questions around why would we not use them.
This in Spanish.
I do not have it in Spanish.
So, and I would say, I would recommend one place that you might want to get to a big population in Spanish is to check to IDN. And at their weekly, Wednesday afternoon, weekly food entry, their parking lot, you could easily have a table. I know they've reaching out for health communities and expanding the health and human service agencies that come to the to table there and promote programs. So we can do it in Spanish. That's it.
I will definitely connect with you on that. And I hope also, I would love to do something in the new parkwood in Midtown Cornell, because it goes down some great neighborhoods, some great streets, and everything from, like, we could host a family neon night walk. It's going to get dark soon, I asked Drew, I was like, Drew, can we do the whiz? And he's like, yes. But then we started talking about pop-it theater and things like that. And that was one. So there's potential to do like many collaborative things. And so I'll stop there. And,
sorry, like open house nights at schools. Another way to get feedback from parents and especially schools that might, again, sorry to my sort of resource which I think can be worked out often. Resources and so.
Don't see anybody with their hands up on Zoom. Marcia, do you feel like you got some good feedback for your next steps?
Yes, so in my next steps, I want to, I'm going to reach out to African Roots. I'm going to get with Susanna. I want to talk about who might be able to translate this survey for us. And I think maybe, and also to, to send a reminder like to you all to take a look at it and appreciate any feedback before officially sending it out. And let's see how much data we can gather.
You might, sorry, I like surveys. Yes. If you only want for residents, you might want to ask that question, are you a resident?
I will do that for paper because online, if you check no, it says, thank you for your time. So I just set it up. I'm like, really, if you don't have to live here to recreate.
Yeah, right.
So that's why it's like, do you like recreate in the city? But if you don't, then.
Our colleague Kristen has her hand up.
Yes, Kristen.
Hi, Kristen.
Hi. Hi. Sorry, I've been trying to listen very well. Were you asking where the baby was?
Yeah. Oh, we like you,
Baby is a Grammy over here. I was going to, I think also this is so exciting because I haven't been hearing what's been going on for like 2 months because I've been in a time warp. So this was really awesome to hear, Marcia. I miss you so much. And it's super cool to hear about your work. I was just going to I was looking at your survey, which looks amazing. I was going to maybe offer a suggestion of a question. I don't know if that's still open to it. What was that?
It's a draft. I mean, I'm sharing it for feedback.
Oh, okay. Just one. I was reading through, I think that what I keep thinking about is asking people rather than like, just what they like to do, what they want to do, how often. I think looking at the first question is how often do you use a City of Kingston park? And people can put in there how often they use it. Maybe if they don't use the parks or if they don't use them very often, asking them what the barriers are or why not. Because you have a great question in there about why are you not more physically active, which is, a super important piece of information to learn. But that's not, if you're looking specifically about why are people using our parks or not using the parks, just asking them, like, what's your barrier to using the park? So if you have thoughts or room for one more question, I feel like that might be interesting to learn.
Kristen, I think that is great. Thank you for offering that. As one of the residents from Yosman Towers told me, it takes almost 2 hours to get to Forsyth Park from Yosman Towers because you have to change at the plaza when it's a 7-minute drive. So that's a great question. Thank you.
Any other questions about Playwell? All right. Yep.
No, I didn't have a fully formed thought. I was just like, I know that there's so much going on and I'm so excited to catch up on the park, like the Broadway Prince Landscape Design Project. And it feels like also that's kind of adjacent to Playwell. And that was not my fully formed thought, was how I could contribute in that way. And that's where it ended because I have sleepless mommy brain at the moment.
No, and thank you for that, Kristen, because you're queuing me up to bring it up. So I'll just quickly mention the Broadway and Prince Landscape Plan. The public outreach phase is happening and it will close October 31st. And I'm putting in the chat and maybe I'll email it out to everyone. The survey on Engage Kingston, we're looking for feedback on what people would like to see at Broadway and Prince. Our consultants are going full speed ahead, collecting that public outreach. I believe the goal is to have a draft in December that'll go back out to the public. So get the word out for us, please. Does that finish your half-formed thought, Kristen?
Honestly, my thought is gone now because I don't know. There's like a hole in my brain at the moment. I saw that there was an event happening on Sunday at Broadway Bubble, which if I can make it out of the house, I might be there with the baby. So if anyone wants to come say hi to Walter Finn, who is really adorable right now and is amazing and wants to say hi to everybody, we might be there, hopefully.
Thank you. Awesome. Yeah, it's a good reminder so that those green spaces will become part of the City of Kingston's park plans. So that is definitely part that can feed into Playwell. Absolutely. All right, I do want to make sure we have time to talk about the draft ordinance. So any other last questions? I can lead us in a quick stretch break if you like, or do we want to keep plugging along? Okay, so let's keep going because Susanna's got to go. So next up is the new ordinance. Ellie?
Sorry.
Yeah. Do you want to come? Oh, it's going to come closer. Where are we? Okay.
Okay. Hi, everybody. My name is Ellie Bernstein. I work for I'm the city's environmental specialist. I work for the sustainability office in the Parks and Recreation Department. An initiative that I've been working on now for a few months is a bike share program that we want to bring to the city. So this started off, just to give a little background, started off in May. We had the Earth Fair at Forsyth Park, and we had e-bike demonstrations there. And our vendor, B-Vegan, provided a survey for anyone who wanted to try the e-bikes, where they could say, do you want to see this in the community? If you want to see this in the community, where do you want to see it? Do you have any concerns, etc.? Overall, the response to the survey was very positive, and so we decided to move forward with an initiative to, work towards bringing bike share, docked bike share programs to Kingston. But in order to do this, in New York State, the municipality first has to enact a law that actually allows those systems to operate in the city. That's how it works with the state vehicle and traffic code or something like that. So before we can get community feedback on where they want to see this or what their concerns are, before we can issue an RFP, before we can bring in a vendor or identify sites, we just need to pass this law first. which essentially says that these systems are permitted in the city. So I brought this draft was provided to me by Bob Dennison from the Complete Streets Advisory Committee or Council. And they worked on this last summer. I have taken a look at this. My supervisor, Julie Noble, has taken a look at this. This has been circulating a little bit in the city. We're getting feedback from the city. I got some feedback from the Complete Streets Advisory Council, and I wanted to get some feedback from you, because this is definitely a health initiative.
Yes, say systems have to be in place. This is something that we're saying that the systems are in place. What does that mean? Systems.
Oh, sorry. What I mean is in order to have a vendor come in and install like docks for e-bikes, the city has to pass a law that says that those docked systems are street legal.
Street legal. Meaning
Yeah.
that they adhere to local ordinances or their state ordinance.
Yeah.
So
So the New York State Vehicle and Traffic Law pretty much defines these like e-bikes and shared bike systems as vehicles, unless the municipality enacts a piece of legislation that says that they are like street legal, they can be like, in bike lanes and stuff like that.
so they're not vehicles.
Yes, so it's just like a technicality of like the state law. So I was wondering,
Can I add?
yeah,
So currently with our law, e-bikes would be allowed on our rail tracks, for example. So you sort of have to allow them to be used. They're being used on our rail tracks. But we want it to be legal, so that
yeah. So this covers making e-bikes themselves street legal, but also making the shared systems legal, because the shared systems are only legal if your municipality enacts this law. And that's to prevent a vendor from just say coming in, dumping like 30 scooters around the city. We don't want that. We don't want somebody to just come in and dump them. We want to kind of have control over that. And that's why New York State has this law that says the municipality has to be like the one to enact the law. So this piece of legislation would essentially allow both e-bikes and shared systems, but would require shared systems submit applications through the city, get vendors permits. Any advertising they do is subject to city review. It's details in this piece of legislation where these bikes can be ridden. Right now, that's under A2. That's a section I would want to draw your attention to, because we're having conversations about whether we want them on trails. So there's language in here about allowing them on multi-use paths, for example. And a multi-use path is kind of a vague word that people apply to say rail trail. So a question would be, for example, would we want to see them on the rail trail? Another important question is, what kind of advertising would we expect our vendor to sell? They want to sell advertising space. Obviously, we don't want them advertising anything that they want, because advertising can be very lucrative, and you never know what people are going to want to put on these dock systems. So the advertising bit is at the end here. If anyone is interested in looking at that, that's A18. But overall, I'm just looking for general feedback on the language of this law. Yeah.
Sorry. So are there any other cities that the city of Kingston has looked at for best practices?
Yes, New Paltz passed this. I don't believe that they actually have a vendor come in and like install systems, but they have worked through this law. I believe, I want to say it's Buffalo. Buffalo's the one that comes to my head. Buffalo might not be right. But I believe Buffalo, obviously in New York City, there's massive shared systems, but those are very different, because cities like Buffalo and New York City have, over 1 million people, or I don't know if Buffalo has that many, but, they have a lot of people. We don't have that many people. We're not gonna dump 500 scooters around. So yeah,
I do think bikes. I don't have one yet, but bikes are good.
Yeah.
People, so many people actually get older, use bikes on rail trails. I mean, this is just a personal side. I always think it's a matter of speed, not a matter of doing e-bike. It's like how people use it. So like crazy.
Well, they have a limit here, 20 miles.
Yeah, so the state limit on class 1 and class 2 e-bikes is 20 miles per hour. That is in here. If that seems too high, that's something that we can always change. We are probably only gonna work with class 1 and class 2 e-bikes because we don't want anything like super fast. Class 3. But yeah, if 20 miles per hour seems like too much, or if there's, for example, you want to add a clause that says you can't go more than this speed on the shared pathways or anything like that, any kind of language adjustments that anyone would like to see, I'd love to get feedback on this. Eventually, we do want to bring it to the common council, but right now I'm trying to get feedback from, some city staff, from you guys, from Dennison, from Kingston, from Complete Streets, before we move forward.
Is the geofencing going to be controlled by the city of Kingston, defining those areas? I guess that's the question. And are we requiring all vendors to have geofencing on their devices?
Yeah, I believe there's a clause in
There
there.
is, I wasn't just clear on what that was saying.
Yeah, so all vendors usually do have geofencing on their devices to prevent people from going on.
Want to explain the geofencing?
Oh, so that means essentially the bike says you're not supposed to be here. Like, for example, I was in DC a few weekends ago and I took a scooter, not on purpose. I took a scooter up to like the Lincoln Monument and the scooter said,
No,
It stops.
it stops. It says, you can't be here, you can't be here. And so that's what geofencing is.
same thing with their time. They have a time limit, like 10 p.m. Scooters will shut down at 10 p.m. You're not supposed to
Yeah.
use it.
And they're so heavy that you kind of, it's a deterrent to see.
Yeah.
Right.
Yes.
No, I have my other question would be like, who enforces all this? Fencing.
Yeah.
Terrific, yeah.
Yeah, it's some software thing
Yeah.
in the bikes above my head, but
Yeah.
So the city essentially, what's written in here is that the city would establish what areas, how they want the city to be geofenced, what areas they want people to be able to ride on, what areas they can't ride on, and stuff like that.
Nice, nice.
So scooters is another form of transportation.
Everywhere.
Yeah, they are.
Sometimes that's called last mile. The idea is you use other transportation to get to the city center. Then the last mile, walking, scootering.
Great.
Yeah, so some other things in here, since somebody mentioned it, I would love some feedback on is the time limit. There's been some conversation about whether we want a time limit, what the purpose of the time limit is. I think right now it's written as 10 p.m. to 5 a.m. or something.
Yeah.
But it's I think it's a mix of riding at night and preventing like maybe drunk like alcohol use, people using alcohol, riding scooters, I don't know. But we don't know if that's what we want, just because, people wake up to go to work before 5 o'clock. I mean, people are coming home from work after 10 o'clock at night. The grocery store is open until 11 on weekdays. It's just like,
Yeah, it's just that. Bike trails, places, like, work. If there were separate trails, paths. So,
Well, so the scooters would be allowed on the road.
yes, there'd be street legal.
And then the Greenlights really is being built out, so especially from the new linear park that Marsha maybe mentioned from Cornell Street to Union, so that's a major connector. It is an off-road trail. But I think, I see this as, it could be a real, like we talked about the buses at the
Yeah.
top of our meeting.
Yeah.
This is another form of transportation that I think is very affordable.
there'd be lights on the scooters,
Yes, all the scooters.
that kind of fun. No?
I want to say yes. I'm gonna say probably yes. I can't confirm.
If it's a vehicle, and it's okay under the DOT law, you have to have a fire.
Yeah. Sounds great.
I'd like to follow, I was very intrigued with it because I never saw it defined like this before, so I thought it was really interesting for me and I liked it. And I thought it was well developed. I didn't really have a whole lot of questions, but I guess there will be after you try it on for a while, so.
Yeah, so, something else to note is all these numbers in here, those are kind of all, those aren't set yet. Those will come from a suggested template from, but it's like a New York State implementation guide. So these numbers in here that say 50 bicycles, 100 bicycles, 100 scooters, those aren't set. Those just from the draft. Same thing with the fees. Fees haven't been established yet. But fees we have to discuss with the council. Okay. But yeah, language like advertising and time limits and where these devices should be permitted. That's kind of the language I'm definitely looking for input on, or any other language. So yeah, if anyone is interested in reading, if you find any feedback, definitely welcome. I don't think we're going to be taking this to the council probably until the end of the year, because we're seeking feedback from a couple different groups. So, you know, I can come back.
And everyone could email you
Yes.
suggestions, right? Or you
Yes.
can email to me, I'll pass it on.
Yes.
You emailed us.
I think I did.
Yeah.
Yeah.
So that was
Yeah.
It's very interesting.
Exciting.
also, if anyone has any other like comments or concerns about the implementation of the program, like safety or accessibility, those things are definitely part of the conversation too. And those comments are very welcome as well.
Troy, Ellen, want to say something?
Yes, thank you very much, Ellie, for this. I just have a clarifying question around, I did read it through, but that was yesterday, so I didn't retain all the information. But it seemed to me, and I guess this makes sense, the ordinance does not need to address things like how much it would cost a rider to use this system. That will be separate from the ordinance. Is that correct?
That's separate. There are
Okay,
fees in here,
but-
all the fees that are in here are applicable to the actual vendor. For example, at the end here, there's a fee that they charge the vendor, I think something like 10 cents per ride or something like that. The fees for actual users are determined by the vendor. We will be like issuing like an RFP for vendors where they can, you know, give us the amounts that they're charged.
right, but will the city be able to have input about what the vendor is able to charge?
Yes, yes.
Okay, because I think many people who will take advantage of this will not be able to pay exorbitant rates. I understand there's a profit motive here, as with many things, but hopefully we'll have the opportunity for the community to have input around those types of issues as well, when the time is right. I know that's down the road.
Yeah, I agree. Another thing to note on that is to bring like more profit to the vendors. That's what the advertising space is for. So in order to keep the cost of actual rides down, the vendors are able to sell advertisements on their scooters, on their bikes, on their docks, and that will bring them profit. So then they don't have to charge the users a large fee.
Right. Well, thank you very much for that clarification. I appreciate it. And I will let you know if I have any comments, but I just want to let you know I am in complete agreement with this in principle. And particularly, I hope, because I live in the Wilbur section of Kingston, it would be really convenient to have these things down here for people to get around, because the bus doesn't come here.
Yeah, absolutely. I think they would be really great for our city. I thought of something else to say. No, go ahead. I lost what I was.
The only thing that I was thinking too is like, how do we couple safety drivers? I know that they're it's such a big, no, they're approved, right? They're approved vehicles, but as we know, we're such a society of cars.
It goes both ways, educating the folks who are using the devices as well as educating, the drivers of cars. So that's one here.
Well, and as some of you may know, we have the Be a Road Hero Transportation Education campaign now, which is sort of set up. I have all of the working files. So So if we wanted to do an education campaign for any user scooters or drivers, we have templates. And so if the city decided to craft language about the education that they specifically wanted, we have a system. We'd have to develop.
One last thing I forgot to mention is eventually, once we move this forward to the common council, an ask of you might be to write a letter of support if you're in support, because I do feel that letters of support from Climate Smart, Live Well, and Complete Streets would make this a very strong distinction. So, after you get the chance to go through it and provide feedback, and incorporate the feedback, I would love a letter of support.
Sounds great.
Thank you.
Yeah. Thank you. Okay, great. Does anyone have anything else? That's it. Okay, great.
Oh, don't be, so I think we should be sort of done with the agenda for tonight, unless anyone has any business or anything else they'd like to.
Well, I just want to ask one quick question because it's just came to my mind. I've been hearing it, Susanna, before you go, especially for certain communities, the availability of flu shots, because it's supposed to be extremely bad this year because and I didn't know if there was anything we could do to support an initiative, especially with our BIPOC communities, because they're most at risk, and our Asian communities, because they're not getting unless they ask, they're not getting that higher dosage of vaccine. And it gives me great concern thinking about our community, folks not having access to shots if they need it. And I don't know if there's anything we can do or anything.
What are the barriers?
Usually access to them and the higher dosage, knowing that, and of course the cost of vaccinations as well.
Are some shots free in pharmacies or
No, not always, no. People who have insurance, yes, but not always. And so that was just a concern. I think that, certain places where, again, you can't get transportation, do you go to, is there a way to go to, I'm certainly on board helping out with it, getting into these communities and finding organizations, shots. Yeah.
And Joylyn thinks you thought there was one at the Kingston Hannaford? In the Kingston Plaza?
Wasn't, I mean, I thought it was a flu clinic, a flu shot clinic a few weeks back. Did I see signage or am I imagining this?
I don't know about it.
I don't know, and I'm willing to, like I was saying, I'm willing to open the wide doors, but I don't know, that might not be the right location. I'm thinking just go right into the some of those housing areas that need it, and just saying, set up whatever there.
or through like an agency that serves
Closer there, or
Yeah.
whatever, That is just a concern, because I feel for people who are just finally getting out and on their feet. And
historically, do you think 40% of people who should have been flu vaccinated?
Right, exactly,
that's
and
very
even less
historic.
for those populations that are at risk.
Yeah. So I think there's also some, so that's
Entirely because of the access, it's just, so I don't know if there's something that we can do as, I don't know, support, I don't know.
I can ask, maybe ask at the institute what we're seeing, there's more reluctance, less reluctance. I can't offer up staffing, that we're.
And I was just, if you've heard of, or anybody, in this, who have done any, what's available out
Healthcare has
there.
been decimated. In terms of percent providers.
Right.
It's been really hard. But to the one of the clinics, and that kind of stuff, but maybe even finding out, like,
Yeah,
where in the community that's close to the communities you're talking about had available vaccine clinics. Yeah. Yes, and Stacey. I can do a little research.
I'm just concerned, it's gonna make, hearing it's gonna be awful, especially the bad for,
Yeah.
folks who've already been hit hard.
Yeah, it's true. I know people aren't really thinking about this.
Yeah.
somebody who had it once and then started getting flu vaccine afterwards. So I did it before. I was like, oh, never again. But,
Yeah. Thank you, Suzanne. Thank you, Patty, for bringing it up. Troy Ellen doesn't have her hand up. Any other things you want to bring up? Announcements, communications?
I will say it's great. And I will be a good cheerleader for you. So much better.
Nice.
Yeah.
Yeah, Suzanne.
We have just a walk with ease program going online. I think it's open for everybody. And we'll be starting some chronic disease prevention programs as well for the public that we've been getting training for and funding for.
Is it the same?
Yeah, through the Arthritis Foundation. I'm actually going through the tutorial now myself, so I can start working groups for A12
Yeah.
and our chronic disease self-management.
Yeah.
You have your own trainers like for that?
Yeah,
or something?
yeah. And then the diabetes prevention program as well. We'll be working on as well. And the Live Strong training as well. So exciting to be involved in that, being able to offer it probably about 6 to 9 months of full plethora of programming to be able to bring to the parks.
Yes,
You know.
that's the-
Anything else anybody wants to bring up?
No, I don't want to step on any commission members' feet, but no, the reason I came to your meeting, besides being interested in well, and having some history with travel well, is just to let everyone know that one of the funding sources that's available to the state is now funding the programs that I run at the Y. It's through a program that I call Traffic Safety Education for Vulnerable Road Users, which goes from October to next September. And it gives us some resources to do education and events to what we call vulnerable road users, which encompasses old people, young people, people of color, low-income people, people on bikes, people walking, people on scooters, all those people who, when they're traveling around, are at much greater risk of injury or death due to motor vehicles. So that means we will have after-school and summer programs for kids. We'll have repair and safety clinics for adults to get their bikes to be safe. And we'll also have outreach programs in Spanish and English. And I look forward to sharing that program information with you and getting it for locations in the city, groups that you think might be interested in hearing about traffic safety and how it can help make them safer and healthier. So that's all.
That's not all, because it's really important.
It's like so important. I have a very short commute, and the level of fear people have when they're crossing the street, I mean, they just run for dear life. It's awful. Everyone's so impatient when they're traveling.
So one of the challenges has been during the pandemic, we saw traffic deaths and injuries increase way above a downward trend we've been seeing for like the past 20 years. And there are a lot of reasons for it. There's some question marks about, is it going to be permanent, these changes that we've seen, or are there ways we can address people's changes in attitude? So one of the big things is how do you get drivers or vehicle drivers to really behave. And they're the ones that fight pedestrians, to fight bicyclists and scooter users, anyone who's trying to cross the road, trying to cross the road. On Broadway, for example, we have these great flashing lights. You push the button, it's supposed to activate the lights to let the driver know that someone's going to cross the street. He stops for these lights. So we've been talking with enforcement agencies about how we can do some targeted enforcement, or how they can do some targeted enforcement to try and let drivers know, hey, this is serious. We're going to give you education, tell you about this, but next time we take it. So
crossing guards are not just for children anymore. Like, we need crossing guards. I mean,
Well-
you know, I'm not saying that this is gonna take, but,
And just on the walk with these, one of the things that we're going to be doing with the Y program and any other program we start up is to talk, have one part of the program talking about outdoor walking. And we know we do it for health, and it's good to do it all gym or Y. But if you actually want to walk somewhere for utility reasons as opposed to health reasons, how could we be safer to do that? So we include safety messages along with the health recreation messages for the program.
Which is a great crossover for age well.
Yeah.
Kingston.
and I have some great walkability tools, toolkits from AARP. So my next steps, like, we gather together a group of people together, and now people who can run in high heel shoes, but people with different, like myself, I have to have people on my team who have different levels of, agility and mobility, and just take it street by street to do a walking.
That sounds really
Yeah, maybe I could get with your walking, if they want to collaborate on like walking maps.
Yeah.
Looking at curbs, broken sidewalks.
Yeah.
Where you can rest, use the bathroom, etc. Crosswalks, like, street lights. Well, thank you for taking it. And thank you for doing the grant. It's a really big deal. Thanks for housing. It's really good work. That's awesome. I'm so excited. So great stuff.
Any questions, you can email me or call me anytime. Talk about it. Hand out materials, do programs.
Try to support you.
Trail, did you want to say something? You could put some stuff in the text in the chat.
Oh, yeah, I just wanted to say thank you, Tom, for this. And I have noted that on Broadway, I very nearly, when driving, been rear-ended because I was stopping to let a pedestrian cross. I had somebody lay on their horn as if the lights weren't flashing to let somebody cross. Now, it's my training, it's habit. I moved here from Connecticut, and Connecticut, it's state law. Literally, even if a person is jaywalking, you have to stop, or you can be ticketed. So I think that hopefully some sort of education for drivers would be helpful. And then talking, Marcia, to what you were saying about walking maps. This is the joke, and I know they're trying to address it in the new zoning code, but you can't walk in the Wilbur because there are no sidewalks. So, you can't navigate unless you want to risk getting, I'm short, so I always risk getting hit by those, those mirrors that stick out from trucks.
Yeah.
I can't tell you how many times I've had to, just veer out of the way for that. So sidewalks would be nice. Otherwise, I have to drive to find sidewalks to walk on. And it kind of defeats the purpose of the exercise for me.
Yeah.
Thank you for that, Joella. All right, thank you, everyone. Our next meeting will be November 16th. In November, we were going to have all of the focus teams come together and do meeting presentations so that we could all sort of get a bigger collaborative picture of what all the focus teams are working on, sort of like a speed dating of focus teams. So that'll be good in November, and then we'll figure out how we feel about some holiday. In the past, we have done a holiday in December. Let's discuss that. See how we feel.
If I may, Emily, send that out right away to the commissioners saying, hold the date.
Yeah.
Save the date, whatever the language is.
Thank you for that. I will.
And I will plan to be there, and hopefully it'll be in this big room.
Yeah,
if we're going to have, members of the focus teams.
yep. So the reason we're here tonight is the police commission is happening at the same time, so we kind of got. And if we do that, I'll make sure I have the mic system, and then that way we can spread out and still be heard, so.
Right.
Okay.
Thank you. It was good seeing you all, even though you're about that big on my screen.
Me too, try
All right.
Ellen.
Good night.
See ya. Bye.